Alright, so next up is talking about the sleep cycle. If we look at how we cycle through different types of sleep, this is the idea of the sleep cycle. So don't get this confused with the circadian rhythm. Circadian rhythm is telling you about when to wake up and when to go to bed based on the light-dark cycle, based on the production of melatonin. But the sleep cycle is while I'm asleep, how do I sort of cycle through the different stages of sleep? So, the sleep cycle is essentially about every 90 minutes where you pass through a cycle of sleep stages. So there's these distinct stages of sleep that you pass through, and you restart that cycle every 90 minutes. And so we know that this is the case by looking at the brain and what's happening in the brain, with specifically looking at brainwave activity. So, when we look at the brain while we're asleep, we can do this essentially using a machine called the EEG, or the electroencephalogram. So what basically an EEG is it's taking measurements of action potentials. So each neuron doing action potentials is separate, but what we notice is that the brain tends to have patterns of groups of neurons sort of and the action potentials that they're firing following a certain pattern. And so as it follows a certain pattern, we sort of see a wave of activity by the neurons. So large groups of neurons firing at the same time creates essentially an electrical wave that we can measure. And by looking at the differences in these waves, we can understand what stages of sleep someone's in. So those brain waves are almost like significant of a state of mind, almost like a type of consciousness you could think about. So when you're awake, we've got a lot of sort of erratic brain activity. But as you get into stage one, we have a little bit less erratic stages of, if you get into stage one, you have a little bit less brainwave erraticism. It sort of starts to fall into a more of a pattern called alpha waves. Stage two of sleep is a little bit deeper, which we'll talk about. Again, we're sort of calming out our brainwave activity, and so the brainwaves are in theta. And then stage three is almost like deep sleep, where we see more of a large brainwave activity associated with delta. And then we jump into something called REM sleep, which we'll talk about, which that type of brainwave activity almost looks like when we're awake. And so we'll talk about why that might be the case as we talk about what happens during these different stages of sleep. So essentially you're awake, you fall asleep, stage one, you get further into stage two, you get further into stage three, and then you go into REM, and then you sort of go backwards into three, and back to two, and back to one, and then if you wake up, maybe you wake up, but the idea is that you're sort of passing through these stages all night long. So, what's the big differences between the sleep stages? We have two that are mainly differences of NREM versus REM. NREM means non-rapid eye movement, and REM means rapid eye movement. So NREM is like the earlier stages of sleep. As you're falling asleep and getting further into sleep, you're not dreaming during this type of sleep. So one of the misconceptions is that we dream throughout the night. You do not dream throughout the night. You only dream during a specific sleep cycle, which is called REM sleep, or rapid eye movement sleep. Now, this is the later stage of sleep. You have to pass through NREM and all the different stages of NREM before you get to REM. Now, why do they call it rapid eye movement? Well, one of the things is that when you're dreaming, your actually body is paralyzed. Your reticular formation and the pons are basically blocking the ability for the brain to send signals out of the brain to move the body, and that's because you don't want to be moving around and acting out your dreams. So the idea is that during REM sleep, everything is frozen in your body. You're paralyzed except for your eyes. And so your eyes are sort of moving around, almost looking around as you're dreaming. So they've actually seen people while they're dreaming, and they wake them up, and they've seen that their eyes are sort of going back and forth like this, and they're like, what were you dreaming about? And they're like, oh, I was dreaming about tennis. So in their dream, they were watching a tennis ball go back and forth, and their eyes are sort of, acting that out. But their body isn't, because their body's paralyzed. So the brain activity changes as we get through all the different stages. So as you first fall asleep, you're in NREM 1. That's like you're just falling asleep, those beginning stages of falling asleep. So we're in alpha brainwave activity. A couple of the phenomenon that you need to know for this stage is something called hypnic jerks and hypnagogic hallucinations. So essentially what hypnic jerks are like muscle spasms that we sometimes have. You might notice that sometimes as you're falling asleep, you sort of wake yourself up by flinching, right? You almost feel like you're falling. it's that feeling of falling that's really a hallucination. It's not a dream, technically. It's just like a hallucination that you're having. They're not quite sure why that's happening. It's probably just some sort of an interruption in the ability for your brain to get into those sleep stages. But again, if you see someone having that hypnic jerk, it means they're probably in that first stage of sleep. Stage 2, or NREM 2, is light sleep. So you're getting a little bit into a more deeper state of sleep, but still fairly light, still fairly easy to wake someone up at this point. Brain waves look like theta, so we're getting deeper in the brain waves. Body temperature and the heart rate starts to drop, so we can actually see the relaxation of some of our biological systems here. One of the things that happens with the brain waves is something called a K complex. So a K complex is where normally we have this sort of nice theta brainwave going on, and then we see this sort of erratic jump in the brain waves, which is a K complex. Again, they're not quite sure what's going on there, but it's sort of the largest event of any EEG that you'll see, but it's technically healthy. If you see this while they're awake, it's probably not a good idea. It's probably not a good thing. They could be having a spasm, or they could be having a potential seizure if you see something that drastic in the brain waves while they're awake. But sleep spindles are another thing that happens during NREM2, and basically that's just a burst of brainwave activity. So instead of doing nice theta waves, they sort of start doing random, more similar to awake brain waves while they're in this NREM2 stage. But it seems to be activity that's coming from the thalamus that's doing that. So it could be the beginnings of a dream coming on, essentially. Then we move into what's called the NREM3. So NREM3 is deep sleep. This is where it's really hard to wake somebody up. You probably have to shake them a little bit to get them to wake up if they're in NREM3. Now, basically the brain waves look like delta, which is a nice long brain wave that we're seeing. Some people can actually get to this sort of stage of brainwave activity delta with deep and practiced meditation. So they can almost get themselves into this level of consciousness, almost like they're in a deep sleep. And this is where we see blood pressure and breathing rate decline. So again, the body systems are really relaxing here. So relaxed actually that the muscles relax to the point where children might wet the bed at this point. So the muscles around the bladder will relax to the point where they have these accidents in bed potentially. We do notice that there is some physiological activity that happens, especially when we're younger. It can continue in the older ages, which is sleepwalking. So sleepwalking sometimes is thought of as a dream, but sleepwalking is not a dream because you're not dreaming. If you wake someone up while they are sleepwalking, they will not be able to tell you about what they're dreaming of because they're not dreaming. It's sort of this interruption of NREM3, that part of their brain is sort of waking up while the other part of the brain is still sleeping, but they're not consciously dreaming. So deep meditation, like I said, sort of shows some of the same delta waves. So if you can become a trained meditator, someone who's really talented at it, who's been practicing for years, you can actually meditate and slow down your own blood pressure, slow down your breathing rate, basically relax your bodies, sort of taking over some of those autonomic functions, specifically with the sympathetic nervous system or the parasympathetic nervous system, and being able to sort of calm yourself. Some of the people who are professional divers who don't use oxygen, they can actually get into a meditative state where they're actually pumping their heartbeat a lot slower than normal. Reducing a normal heartbeat by almost half, which reduces the amount of oxygen that their muscles are going to be needing. And so, again, they're sort of taking themselves into a meditative state of almost being asleep while not being asleep. So, after NREM3 happens, then we go into dreaming, and this is REM sleep. So rapid eye movement is dream sleep. It's the same thing. Again, the idea is that the brain waves are almost turning back on in a way that looks like conscious awakeness. And the reason why is because you're probably going into a dreamlike state. You're almost imagining a world happening like you were in a conscious state. That's why sometimes when you're in a dream, it's hard to differentiate from consciousness until you wake up. Now, it's thought to be that dreams are really important for neurological repair and maintenance, like we talked about. So it's potentially that these dreams that we're having are very important for allowing us to repair and also understand and process information and memories while we're awake during the day, and then turn those into long-term memories at night. So the heart rate and the breathing actually jumps up a click. So it's again, all of sleep is sort of going more into a deeper state of relaxation, but REM sleep is very much an active state. And so REM sleep is where your heart rate increases and your breathing increases, almost like even more so than when you were awake. And so this is like an arousal. REM sleep is more of an arousal of the brain. Again, arousal happens in a lot of ways. So we have genital arousal that happens during both sexes. So while you're sleeping, men will often get an erection, and women will obviously get aroused as well. It doesn't mean that they're dreaming about sex particularly. They might be, but the idea is that it's just arousing the body. It's a natural autonomic sympathetic system where it just arouses your body and it arouses you in that way as well. Now, the only part of your body that's not aroused is the actual body, in the sense that you cannot move. Again, we said you're paralyzed. So the idea is that the brainstem, particularly the pons, is blocking motor signals that are coming from the brain. So you're thinking about running away from a bad guy in your nightmare, but you don't want to actually run away from a bad guy while you're sleeping. So your pons is basically saying, "No, idiot, it's just a dream. Don't run around, in your neighborhood naked at night because that could be dangerous." So again, the pons is basically preventing you from acting out your dreams. Now this whole cycle occurs about every 90 minutes. So you go from NREM1, NREM2, NREM3, and then you go into that REM sleep. About every 90 minutes you're sort of passing through these cycles. Now, without REM sleep, you actually will wake up feeling unrested in the morning. And this is one of the reasons why people have sleep deprivation, is because they're actually not getting into REM sleep. They're not feeling rested enough. And we'll talk about why they might be not getting enough REM sleep. They've even seen that with less REM sleep, there's a lot of diseases and other disorders that can arise, like Alzheimer's and Parkinson's and mood disorders and memory and learning impairments. So it's not just about feeling rested. This is actually about your biological health that's important for getting enough sleep, and specifically enough REM sleep. So how do the sleep stages progress as the night goes on? So as we can see with this sleep cycle, if you were to sleep at 11, you go to bed at 11 and you wake up at 7, that's an 8-hour night of sleep. Technically speaking, you should go through 5 cycles of NREM1, NREM2, NREM3, and then REM sleep, which is dreaming. So if we see you're awake, you go into NREM1, stay there for a while, NREM2, go to NREM3, which is actually quite long, and then you jump back into NREM2, and then you jump into a dream. So you only dream, towards the very end of that cycle. And so that's why we say that every 90 minutes or so you go into this NREM, or you go into REM sleep. After you have that maybe 10 to 15 minute dream, then you go back into NREM2, you go back into NREM3, that's a deep sleep, you're there for a while, jump into NREM2, back into a dream. So every 90 minutes you're sort of passing through these cycles. Now this is just indicating that you might wake up and roll over or something like that, or go up to the bathroom or whatever it is, but the idea is that every 90 minutes you're basically going from NREM1 to NREM2 to NREM3 and then back into a dream. And so basically you only have you only have about 5 dreams as you progress through the night. But you can see that as we go on, we spend less and less time in NREM3, getting less and less time in NREM3, and more time in a dream. So that last dream right before you wake up in the morning is usually your longest dream. And this is why it's so important to try and get 8 hours of sleep. Because let's say you only got 6 hours of sleep or 5 hours of sleep. You would only get through about 2.5, 3 cycles essentially. So you'd only be getting 3 dreams, and not very long dreams. And so if you only get about 5 hours of sleep, you're missing out on that most important type of sleep that's going to make you feel rested. And that's why you need about 8 hours of sleep to feel rested, is because you can get through all of your cycles and get to those dreams that are actually going to be longer, and spend more time in REM sleep, which is that recuperation sleep. So that's why it's important to get that sleep, guys. Now, one misconception that you really need to know is that a lot of people think that we go from 1, 2, 3 and then jump into a dream. 1, 2, 3, dream. 1, 2, 3, dream. No. But what we do is sort of go up and down the ladder. We go into 1, 2, 3, back to 2, and then into a dream. And then 2, 3, 2, dream. 2, 3, 2, dream. That's essentially what we're doing. We're not just jumping from NREM3 into a dream. Now, one thing that's interesting is that if you did not get enough sleep. For example, let's say you only slept 5 hours, so you only got about 3 cycles, and you only had about 3 dreams. If you did take a nap during the day, or if you fell asleep in class that day, your body knows that you didn't get enough REM sleep. And so what it does sometimes is it will recoup your REM sleep by jumping into REM sleep almost immediately when you fall asleep. So sometimes the sleep cycle doesn't follow, and you just immediately jump into REM without having to go through those stages because your brain is trying to catch up for lost REM sleep. So if you're sleep deprived, we see people who don't follow this normal pattern. They just go straight into REM sleep because their brain is really needing that. Some people don't follow the sleep pattern either. My wife is one of these people. She falls asleep and immediately she starts dreaming. She doesn't really jump into 1, 2, 3 dream. She just immediately starts having dreams when she falls asleep. It's amazing. Like she can literally, like flinch her body for a second. And I'm like, oh, she's sleeping, and I wake her up. And I say, what were you dreaming about? And she knows exactly what she was. She's got a dream right off the tip of her tongue that she can tell me about, like literally in the 5 seconds that she fell asleep. So, not everyone does this, but for the most part, people follow those stages. Newborns don't follow the stage either. Technically, they will skip from sort of these NREM stages and go straight into REM sleep. Again, they're sort of really needing that processing, recuperation, growth type of REM sleep for their brain development. And they spend about 50% of their time in this baby REM, like newborn REM. And that's essential for their brain development. Again, if they're not sleeping enough, they're not going to grow enough, they're not going to have enough brain development, they're going to be cognitively delayed, essentially, if they're not sleeping enough. So let's talk about sleep disorders, especially with sleep deprivation. So again, sleep deprivation has a lot of effects on us. First of all, the cognitive ability, it diminishes our focus, diminishes our ability to consolidate our memories at night, and can affect all kinds of stuff like depression and our mood and everything like that. It has negative effects on our heart, increases blood pressure, increases the risk of high blood pressure. The immune system is depressed if we're not sleeping enough, so we're more susceptible to getting sick if we don't have enough sleep. Even cancer, because our immune system is fighting off those cancerous cells. Again, increased production of fat cells. We have greater risk of obesity, so our metabolism is actually negatively affected if we're not getting enough sleep. Reduced muscle strength, lower reaction time, so the somatic system of our nervous system is also slowed if we're not getting enough sleep at night. And joints, we can have a lot of problems with inflammation. When usually we have inflammation, it's because of our immune system, and our immune system is attacking our own body essentially, and that's what inflammation and arthritis is. So, lots of reasons why you should get sleep at night. Now, what are some of the problems with sleep that we can look at? So, one of the main problems that we see, especially with older people and with men, is something called sleep apnea. So, some people confuse sleep apnea with just, snoring. It is related, but it's not the same. Basically, what sleep apnea is where you can just completely stop breathing for a short period of time while you're asleep. Could be a few seconds, could be up to 30 seconds. But the idea is that you're basically not breathing while you're sleeping. So some of the symptoms of this we see is that we have people who have really loud chronic snoring. And I don't just mean like, they kind of snore. I mean like it's like a grizzly bear. If you've ever been next to somebody who has sleep apnea, you know what I'm talking about. They sometimes will have this choking or gasping sensation after the pauses because their brain is sort of waking them up to say, hey, idiot, you're not breathing. And so they sort of wake up just enough to take that gasp of air before they fall back asleep. They often wake up with a sore throat because of the snoring that they're doing, morning headaches, all kinds of stuff. Um, this is basically disrupting their sleep cycle because they're going into a very, very deep sleep where their muscles are relaxed so much that they're literally sort of blocking the airway that's in allowing the air in, and that's really shutting off their ability to breathe. So they're getting into a relaxed state of sleep, but as they're getting relaxed, they block their own airways essentially, and the brain wakes up to say, hey, idiot, you need to breathe. So they gasp for air for a second or two, and then they fall back asleep, and they start to get into those sleep stages again, but they never make it to REM sleep because the moment they're about to get into REM sleep, they wake themselves up because of their sleep apnea. Now, they're not conscious aware of this, right? And so they wake up extremely tired in the morning and not knowing why, and it's because they just never got their REM sleep. So sleep apnea, if people usually know it because you can tell people are doing this when you're sleeping next to them, but if you don't have a partner who sleeps next to you, it's hard to know that you've got sleep apnea sometimes. But Lots of things can be at risk or increase your risk of it. One of them is obesity, so just having more fat and more, more mass pushing down on your throat as you're sleeping can increase your sleep apnea. Could be a deviated septum, so you've just got problems with your nose and being able to breathe essentially. Alcohol consumption, all of these things can also increase the amount of how relaxed the muscles become in your trachea and in your cavity essentially for being able to breathe. Uh, Old age can do it as well. So, if you've got a father who's in his 50s or 60s who drinks alcohol, who's obese, he's probably at high risk of having sleep apnea. Then we've got narcolepsy. Narcolepsy is a neurological disorder caused by the brain's inability to regulate sleep normally. So essentially, what narcolepsy is it's your inability to stay awake. It's like your brain is throwing you into sleep without you wanting to. So the symptoms of it are fatigue and excessive sleepiness. So they're not really getting good sleep at night either. Um, Something called cataplexy, which is really a loss of muscle control. So it's almost like the paralysis that happens during REM sleep. It's like the pons is sort of shutting off some of those messages going to the body while you're awake. And so sometimes people with narcolepsy will have these sort of momentary lapses of muscle weakness, which is called cataplexy. Insomnia at night, so they're not sleeping well at night, which affects their ability to stay awake during the day. And hallucinations, which is almost like the brain trying to go into REM sleep for them and having a dream essentially while they're awake, which is essentially a hallucination. Now, one of the myths is that people with narcolepsy don't actually sleep any more than a normal person. They actually sleep about the same amount. It's just that they can't control when it happens. So it's not like they're constantly sleeping. They might not sleep at night, but they might fall asleep in the middle of the day. So they're not really sleeping more than other people. One of the reasons why they think narcolepsy happens is that there's basically a lack of orexin. Orexin is that hormone that causes arousal in the brain. And so one of the things that they do is they give you drugs if you have narcolepsy that will stimulate the CNS. So stimulants like amphetamine specifically, which will help excite the brain's neurons and sort of retain a wakeful state. If the orexin's not being produced, they sort of artificially stimulate the brain with these amphetamines. Now, insomnia is the most common one that we obviously have all heard about or maybe even experienced. So this is the difficulty of falling or staying asleep. So all of the symptoms include things like difficulty falling asleep, difficulty waking up too early in the morning, unfreshing sleep, you don't feel rested after you sleep, fatigue, cognitive impair, all the stuff that comes with sleep deprivation essentially is insomnia. About 30% of people actually report having some type of sleep insomnia, and that could be mostly about environmental factors, living in a more stressful society that more pressures on us, more responsibilities that could have a cognitive effect on our ability to relax at night and fall asleep. So normally the problem is the brain is too active. Anxiety is basically the same thing as having a too active brain, and so thus most of the time when we try and fix someone with anxiety or insomnia, we're trying to inhibit the CNS. We're trying to shut off some of those neurons. And so we use things like depressants, like barbiturates, essentially to help slow down that brain activity and help them fall asleep, but also help people with anxiety. Sleepwalking is often called somnambulism, which is another way of saying you're walking while you're asleep. So again, this is the idea that you're walking around performing potentially complex behaviors while asleep. Um, some of the symptoms of it are sleep talking, so you're not necessarily walking around, but they might, have a discussion with someone like in their sleep, essentially. Difficulty remembering the event; they don't remember sleepwalking. A lot of times they resist being awakened during an episode, so it's not necessarily dangerous to wake somebody up, but it's difficult to wake somebody up because they're in a very, very deep sleep. They're not dreaming though, and so that's why it's very a myth essentially to think that you're not supposed to wake someone up because they're in a dream, and if they're in a nightmare, then they're going to attack you because they're like in a nightmare or something like that. People who are sleepwalking are not dreaming. They are essentially in MREM3, which means that they're not having a dream. So if you wake them up, they won't know that they're having a dream because they're not having a dream. But the other idea is that it's difficult to wake them up because they're in such a relaxed state of mind, like their brain is not willing to wake up. But the other part of the brain that's causing them to move around is alert. So it's essentially this arousal of the brain while sleeping. So some of the things that can happen is that, fatigue, stress, lack of sleep, any sort of physiological stimulus like that might cause their brain to wake up while they're asleep, like having a full bladder or alcohol consumption at night before they go to bed, sort of like this, you know, uh, split between conscious and unconsciousness that happens with sleepwalking. So trying to remove those stimulus that are causing them to wake up, at least that part of the brain to wake up, is one way of solving sleepwalking. And again, if that's not working, they could potentially give them something to force them to sort of shut down those CNS neurons, which is another depressant or another barbiturate or benzodiazepines or something like that. So almost kind of the same thing for narcolepsy. Okay, sorry, it's for the same thing for insomnia. Sleep paralysis is where this is a really scary event that some people have, where they wake up from sleeping, and they're consciously awake with their eyes open and they know what's going on, but they can't move their body. So the idea here is that they are being woken up during REM sleep, and the part of the brain that's essentially feeling woken is awake, but the part of the brain that's preventing them from moving is still thinking that we're asleep, which is the reticular formation and the pons. So again, the idea is that the reticular formation is still doing its job by blocking the motor messages from leaving the brain, even though the brain is actually awake and able to control itself. So that's a really weird feeling for people who've had it. I've never had it, but it can happen to people for at least a few seconds while they wake up. They're technically waking up in the middle of a dream. Their mind wakes up, but their reticular formation still thinks that they're asleep, so it prevents them from moving. A lot of times they can still have sensations of being in a sort of a dream where they're sort of feeling like there's someone in their room, or there's like a weight on their chest. It's almost like this feeling of someone pushing down on them, very demonic feeling of people sort of menacing them, and just not pleasant feeling of almost dread, like something is preventing them from moving. The last one, which is different but still sort of scary, is the idea of night terrors, which mostly happens in children, but it can happen in adults as well. It's where they sort of have these fits of screaming and terror while they're asleep. Some people think they're nightmares, but they're not nightmares because, again, they're not dreaming. You can't wake them up and say, "What are you dreaming about?" or "Do you remember what you did last night?" They won't remember because they don't have a dream about it. It's not a dream. Um, Basically, the child is sort of, again, it's almost like sleepwalking, but with this extra feeling of terror that they've got. Uncontrollable crying, uncontrollable screaming, they're shaking, they're sweating. There's this fear of dread that someone's going to get them. They don't even recognize the people in front of them. They're not really interacting with the people in front of them. So it's this combination of being asleep, but also part of the brain of being alert and awake, but not conscious. So again, the idea is that they're not in nightmares because these night terrors happen in NREM3 when you look at the brain waves. So children are technically not dreaming, or people are technically not dreaming when they're having these. Most kids will grow out of it over time, so it's nothing really too bad to worry about. But essentially, there's a significant amount of children that have these at least once in their childhood.